Hello, everybody. I'm your host and speaker, Faika, welcoming you all on behalf of Priority Group Services. By maintaining the flagship of legacy, we are trying to maintain our corporate social responsibility towards our clients and society, along with our professional obligations. This webinar will be another example of that. Throughout the whole session, we will try to help and motivate you in such a way that you'll be enlightened about healthy aging and will also get motivated to take care of yourself. Do we know how to age healthy? Maybe we have some knowledge, but let's discuss in detail so that we can fully understand it and have also the knowledge to implement that knowledge into our practical life. Today's agenda of this webinar is focused on the importance of aging healthy, the consequences of not aging healthy, some steps to aging healthy, what's normal when it comes to aging and what's not, describing the changing demographics in the US and global populations and the challenges of improving the health span of the aging population, the changing demographics in the US and global populations, educate professionals to identify and address disparities that may be exacerbated with age. This topic is really important because people in the US are living longer and the number of older adults in the population is exceptionally growing. As we age, our minds and bodies change. Having a healthy lifestyle can help you deal with those changes. It might also prevent some health problems and help you to make the most of your life. Now let's jump into what's normal when it comes to aging and what is not. The first thing you know is your bones. Bones become thinner and more brittle with age as they lose mass or density, according to Medline Plus, sometimes resulting in osteoporosis. Low bone mass raises your risk of broken bones, including in the vertebrae, meaning bones of the spine, which can cause a stooped posture and loss of height. With low bone mass and osteoporosis are more common in women. They can occur in men too. Be sure to talk with your physician about what you can do to prevent osteoporosis. Oftentimes, the first sign you have is a broken bone. Let's move on to some knowledge about your heart. As you age, your large arteries become stiffer, a condition called arteriosclerosis, contributing to higher blood pressure. The walls of the arteries also tend to accumulate a buildup of fatty deposits called plaques, which also harden and narrow the arteries, reducing blood flow to the heart. The buildup of fatty deposits is called atherosclerosis, and a buildup of plaque in the arteries leading to your heart is known as coronary artery disease and is a major risk factor for a heart attack. While not all of the heart and blood vessel changes associated with aging can be controlled, following a healthy diet and getting regular physical activity can almost always help to keep your arteries and heart healthier for longer. After that common organ about which we are going to talk about is the digestive system. As you age, your digestive tract slows down and doesn't contract as often as it did when you were younger, which can lead to constipation, stomach pain, and feelings of nausea. Many medications also cause or contribute to constipation. To prevent these digestive problems, the Mayo Clinic recommends following a diet that is rich in fiber, drinking plenty of fluids, and keeping as active as possible. And most importantly, doing your best to manage your stress. You also have a thorough knowledge about your senses. As you age, you may notice that your 5 senses, hearing, vision, taste, smell, and touch, aren't quite as sharp as they were when you were younger. According to Medline Plus, changes within the structure of the ear may cause you a cause of degree of hearing loss and may also affect your senses of balance. The sharpness of your vision may dull, and you may need reading glasses. You may start to lose your sense of taste, thanks to a decrease in the number of your taste buds. Consequently, flavors may not be as distinct to you, nor as vivid. Your sense of smell may weaken with age due to decreased mucus production and a loss of nerve endings in the nose. You may also find that your sensitivity to touch, pain, pressure, and vibration is reduced. Although some people become more sensitive to touch because of thinning skin. Now let's gather some knowledge about teeth and gums. The tough enamel that protects your teeth from decay can start to wear away over the years, leaving you susceptible to cavities. Moreover, per the American Dental Association, ADA, the nerves in your teeth can become smaller with age, leaving you less sensitive to pain and potentially delaying a diagnosis of cavities or cracks in the tooth's outer surface. And according to an article published in June 2017 in the American Journal of Public Health, more than half of people around age 65 have moderate or severe gum disease. The same article states that around 400 commonly used medications can cause dry mouth, which heightens the risk of oral diseases. Now let's move on to the biggest organ of the body, your skin. As you age, your skin loses its elasticity and may start to sag and wrinkle. However, the more you protect your skin from sun damage and smoking, when you were younger, the better your skin will look as you get older. The American Academy of Dermatology recommends sunscreen and moisturizer as the two most important anti-aging products you should be using. Wearing a hat with a brim will also protect the skin on your scalp and face. Start protecting your skin now to prevent further damage and to lower your risk of skin cancer. Another most important fact of concern is your sexual function. After menopause, when menstruation stops and estrogen levels drop, many women experience physical changes, including reduced vaginal lubrication. Per the North American Menopause Society, these changes can also reduce your sex drive. For men, advancing age is often accompanied by erectile dysfunction, though, as the American Sexual Health Association points out, this is not a normal part of aging and may indicate an underlying medical issue or occur as a side effect of a medication. Fortunately, many of these physical issues can be readily treated, or if not, accommodated by open-minded partners who are willing to experiment. These are the most common facts we should have knowledge about. We should also have some knowledge about the changing demographics in the US and global populations. It will help us a lot to understand the situation. The US population is aging. Today, there are more than 46 million older adults aged 65 and older living in the US by 2050. That number is expected to grow almost 90 million between 2020 and 2030 alone, the time the last of the baby boom cohorts reach the age of 65. The number of older adults is projected to increase by almost 18 million. This means by 2030, 1 in 5 Americans is projected to be 65 years older and over. The issue of aging is especially important in rural areas because residents tend to be older on average than those in urban areas. Older adults also disproportionately live in rural areas. In 2010, 1/4 of all adults 65 years and older lived in rural areas. This map, based on 2010 census data, shows the percent of the population over 65 by county. With an aging population comes an increasing need for health care, long-term care, and social services to support older adults as they age. Adults over 65 have different healthcare needs than children, and younger adults because they have multiple chronic health problems such as diabetes, heart disease, arthritis, depression, and hypertension. It is estimated that 90% of adults over age of 65 experience one or more chronic condition and need specific treatments and medical care, setting them apart from the rest of the population. Older adults not only rely on their primary care physician, but also on long-term care services and support. Teams of physicians, long-term care assistants, nurses, social workers, and family caregivers often work together to provide tailored and coordinated care to older adults. Access to healthcare is critical for older adults to age in peace. Because many retirees are choosing to move to rural destinations and keep their independent lifestyle, many rural counties are naturally becoming retirement communities. However, these communities have fewer options for geriatric care teams and accommodations specifically designed for older adults, such as retirement communities and assisted living facilities. There are some challenges of improving the health span of the aging population. WHO attributes the elderly population's rapid size increase to a change in the leading cause of death, from infections to chronic non-communicable diseases, which increased life expectancy. These chronic conditions may include hypertension, high cholesterol, arthritis, diabetes, heart disease, cancer, dementia, and congestive heart failure, heart disease, stroke, and cancer have been the leading chronic conditions that have had the greatest impact on the aging population, especially in high-income countries. In addition, the incidences of obesity and accidental falls are increasing. This leads to the question, what are the implications of the aging population on healthcare? We have all heard the term baby boomer. According to the Office of Disease Prevention and Health Promotion, the first baby boomers, born from 1946 and 1964, turned 65 in 2011. By 2030, it is projected that more than 60% of this generation will be managing more than one chronic condition. Managing these chronic conditions, along with the patient's level of disability, will increase the financial demands on our healthcare system. The cost increases with the number of chronic conditions being treated, taking into the account the expected twice as many hospital admissions and physician visits for baby boomers in 2030. Here, this graph also shows the current scenario of upgrading the amount of investment in healthcare sector of our country. Now let's talk about educating professionals to identify and address disparities that may be exacerbated with age. Among older adults, health disparities are exacerbated by factors such as disabilities, isolated living conditions, limited retirement incomes, and other age-related factors. For example, people who are aging with a disability have higher disparities of health risk factors like physical inactivity, smoking, hypertension, and obesity that are counterparts with disabilities. The CDC is working to address these disparities by funding state disability and health programs and national centers on health promotion for people with disabilities across the United States. This will address the needs of people with physical and intellectual disabilities, including older adults. Now comes collect community-wide data to identify and map healthcare gaps and high-need areas, such as naturally occurring retirement communities. An estimated 1/6 of households with at least one person aged 55 years or older are in naturally occurring retirement communities where more than half of neighboring households also include someone 55 years or older. Community-wide needs assessments can examine the services and supports available in these communities, including grocery stores, pharmacies, medical facilities, parks and recreational areas, and public transit options. Collecting data regarding the number of older adults living alone who are at an increased risk of depression, physical health problems, and mortality can also inform community planning decisions. In 2015, 20% of civilian non-institutionalized men aged 65 and older lived alone, and 36% of civilian non-institutionalized women lived alone. Here comes the most important part of our session, which is steps to age healthy. First, what you have to do to stay healthy is stay physically active for a healthy body and mind. Keeping physically active can help offset many of the effects of aging. According to Medline Plus, exercising regularly can improve your balance, help keep you mobile, improve your mood by reducing feelings of anxiety and depression, and contribute to better cognitive function. It is also an important part of managing some chronic diseases, such as diabetes, heart disease, high blood pressure, breast and colon cancer, and osteoporosis. Any exercise at all is better than none. says the CDC, which recommends 150 minutes of moderate intensity aerobic activity, like swimming or taking a brisk walk each week. You can further break this down into 30 active minutes a day for 5 days a week. It also recommends twice weekly muscle strengthening activities. You can find a list of CDC approved physical activities here. Second is to stay socially active with friends and family within your community. Making the effort to interact with family and friends can have numerous benefits for your health. One article published in the Journals of Gerontology, Series B, Physiological Sciences and Social Sciences in January 2019, found that participants all over 65 who reported lower levels of social anxiety were more likely to experience more positive moods, fewer negative feelings, and higher levels of physical activity. If you don't currently have an active social life, look for opportunities to reconnect with old friends or make new ones. Seek out like-minded others in church groups, volunteer activities, gyms, alumni groups, or any other group that corresponds to an interest of yours. You should always follow a healthy, well-balanced diet to get the nutrition your body needs and lower your risk of chronic conditions such as heart disease. Make whole foods that are high in fiber and low in saturated fat the foundation of your diet. Following an eating plan like the Mediterranean diet can help you achieve that goal. The Mediterranean diet emphasizes olive oil, nuts, seeds, fruit, and vegetables, whole grains, legumes, and fish. It's low in red meat, full-fat dairy products, and processed foods. Also, do not neglect yourself. Schedule checkups and stick to them. Regular checkups with your doctor, dentist, eye doctor, and specialist healthcare providers are opportunities to catch problems early and treat them before they become bigger problems. If you have one or more chronic medical conditions, take multiple medications, are experiencing memory or mobility issues, or have recently been hospitalized, you may want to schedule an appointment with a geriatrician, notes the American Association of Retired Persons. Geriatricians specialize in the care and treatment of older people. Following an initial consultation, they can refer you to another specialist, coordinate care and treatment for health issues, and help you create a care plan tailored to your needs. You should take all medication as directed by your doctor. It may seem like a no-brainer, but it bears repeating that you should always take any medication prescribed to you as directed by your doctor or doctors. However, it is also worth doing a periodic medicine review with your primary care doctor to discuss whether all of your prescriptions are still necessary. The more drugs you take, the harder it can become to remember when and how to take them all, and the higher your risk for negative drug reactions as well as drug-drug interactions. While you should almost never stop taking a drug without consulting your doctor first, it can pay to be proactive about reviewing the necessity of all drugs you have been prescribed. And keep in mind that your pharmacist is another resource for information on drugs, drug side effects, and drug interactions. All your effort will go vain if you don't limit your alcohol consumption. The U.S. Department of Health and Human Services 2015 to 2020 dietary guidelines advise that alcohol consumption be limited to 1 drink per day for women and 2 drinks a day per man. However, a more recent report published by the 2020 Dietary Guidelines Advisory Committee advises that men limit their alcohol consumption to 1 drink per day as well. The more recent advice is based on studies that show the mortality risk associated with drinking alcohol is increased at levels above 1 drink per day on average for both men and women. Furthermore, you should also try your best to quit smoking to lower your risk of cancer and heart disease. If you're a current smoker, you'll want to quit as a matter of urgency. According to smokefree.gov, the health benefits of quitting smoking include lower cholesterol, blood pressure, and heart rate, a lower risk of cancer, diabetes and lung damage, and stronger bones, muscles, and immune system. Get the sleep that your body needs in order to keep you healthy. The National Sleep Foundation recommends that adults over 65 get between 7 and 8 hours of sleep each night. As you age, you may notice that your sleep schedule shifts so that you are sleepier in the early evening and ready to wake earlier in the morning. This is not unusual, nor does it pose an issue, so long as you continue to meet the recommended 7 to 8 hours of sleep per night. If you are experiencing chronic or acute insomnia, speak with your doctor, who can help you determine what's keeping you awake and advise you on possible solutions. Always practice good dental hygiene every day. To protect your teeth and gums, the ADA advises brushing your teeth twice a day with a soft bristled toothbrush, flossing daily, and regularly cleaning any dentures you may wear. Not only will your teeth and gums be healthier with this routine, but preventing inflammation in your mouth through good dental hygiene can help you manage other chronic inflammatory conditions such as diabetes and heart disease. Also discuss changes in sexual function with your doctor. If you are experiencing changes in your libido or sexual function that are having a negative impact on your sex life, talk to your doctor about it. The National Institute on Aging notes that help is available in the form of physical aids or medication, as well as in communication with your partner and exploring new avenues to physical and emotional intimacy. Your doctor may be able to refer you to a sex therapist who can help you define what a satisfying sex life will look like for you and how to get there. Here are some warning signs you shouldn't ignore. Please try to listen carefully. These are the signs you should really be careful about. Abrupt weakness or dizziness, shortness of breath, pressure in your chest area, tingling or numbness, especially on just one side of your body, loss of balance or coordination, difficulty speaking or swallowing, excessive sweating, sudden vision loss or blurred vision, marked swelling even when you don't have any recent injuries, rapid weight loss, prolonged confusion, wounds that never seem to heal. Distribute information and implement programs that address critical health issues in later life, such as HIV. Approximately 1/4 of people living with HIV in the United States in 2012 were aged 55 years and older. Individuals 50 and older accounted for 18% of new HIV diagnoses in 2013. However, many public health campaigns to address HIV risk focus on younger adults and teenagers, as sexual health is rarely discussed with older adults in clinical settings. Perhaps a provider or patient discomfort with the topic, or negative attitudes about sexuality and aging. 3.5 million people are chronically affected with hepatitis C in the United States. Up to 75% of adults infected with hepatitis C are baby boomers born during 1945 and 1965, and 50% do not know they are infected. This is all for today's webinar session. I hope you get at least a prior idea about how you can age healthily and maintain it. Priority Groups Services always aims to find the best care for you. Thank you for supporting our webinar. I hope you take everything that we talked about today and reflect on it. I hope you all have a great day.